hormone replacement therapy with testosterone pills. Last video I discussed the doses, instructions for use, effects, and benefits. This video I will be covering access, insurance, and cost. This is where I'm going to quickly apologize because this will definitely be more beneficial for American audiences. There's not a lot of research out there on oral T and trans people specifically yet, so that was a hindrance I ran into in my research. And I also only speak English, which is another barrier in my own research. So again, my apologies. So to start off, here's the thing. Oral forms of T are usually pretty hard to obtain access to. First, for HRTT, you do need to have a prescription for it. Then in some insurance forms that I found, it walks through a whole checklist of whether someone is not a minor, if they have already tried at least 2 forms of T, such as injections, gel, pellets, etc. And then if they have any complications that prevent them from continuing those forms and more. Then for cost, even if patients are approved for this treatment, Goldstein says that there may be additional hesitancies among clinicians to prescribe it due to a lack of insurance coverage and or high cost, which is a known issue in the United States. Then from GAVA, we can see that this issue may be compounded by the fact that TU is expensive and, unlike for hypogonadal men in most countries, is not covered by insurance or by the national welfare when administered in trans men. As a reminder from the second video, all oral forms of T are TU, so this adds to the financial barrier. It is rare to be prescribed right off the bat or prescribed at all. I did also find one article from Brazil that talks about how the drug is approved and available for therapy, but the prohibitive cost makes it impracticable as a regular treatment, especially in the public health system. And the author for that article was Costa. This all sounds really bleak, but people are still getting prescribed it. I have found and even interviewed some individuals who started Jutenzo either in the middle of their transition or at the beginning of it. I'm not going to name drop them, mainly because I did not ask for permission to do that, but there are some people who've been posting on social media about their journey with oral testosterone. As far as cost, it does vary on what oral pill we're talking about, the dosage, and insurance. Out of pocket, without accounting for coupon sites, these are the average prices for a month's prescriptions that I could find. Jutenzo looks to be around $900 to $2,400. T-Lando looks to be around $930. And with Kysotrex, and take this one with a grain of salt because this was the hardest number to track down, and I only have 2 articles saying this, they said $159. I'm not aware of why they're so different in pricing, so that is one area that I cannot answer in depth. From the people I talked to or found online, one person who started on Jutenzo only had to pay $10 after insurance, and another is having his medication fully covered by insurance. So it really depends on factors like financial support, insurance access, the sort of healthcare clinic you go to, and more that I